Okay.
Fine.
Right. Can everybody see my screen?
Yeah.
Yeah.
It's not on presentation view though.
There we go. Right.
Yes, there we go.
Excellent. So shall I start?
Yes, please take it away.
Okay, thanks. So welcome to this session with a panel member's view of doctoral fellowships. So I want to follow on from the excellent talk earlier by Natalie, and a lot of what I'm going to say is going to echo what she said, and I make no apology for that, because I think if something is important, it's better to hear it a couple of times than for it to be missed, and it's for you not to hear it. So a couple of things I'm going to say will echo what Natalie said, also the excellent talk we've just had from the PPI representatives, and Richard's talk right at the start about choosing the right scheme. Okay, so my background is I've been involved in the doctoral fellowship panels for about 6 years now, and a couple of questions have cropped up already this morning about the nature of the panel, so I just want to touch on those before I go through the material I prepared for you. So first of all, it's a two-stage process. So you submit your first application. If you're successful in terms of being called for interview, you're asked to expand on that. So bringing in more details of finances and supervision, that sort of thing. We'll look at that in just a moment. Also, calls for the scheme now are twice a year. Originally, going back, well, as before 2 years ago, they were once a year. So there are 2 rounds now of the doctoral fellowship scheme. And I'm going to go through the kind of process that happens to choose who's shortlisted. And another question we had earlier was about interview. So yes, if you're successful at the first stage, you're called for interview to discuss the second version of your application that includes finances, details of supervision, etc. So just to clarify those things. So as I've said, a few things are going to echo what you've heard already, but I think this is quite important, and I'm going to give obviously a different slant on it as a panel member. So what we want to know from today really is what are the keys to success? And first of all, first stage, we have to identify the right scheme, go for the right funding opportunity. Then we have to determine the right project and the right supervisors for that. Once we've got that, we need to work on our proposal to develop it so that it's something suitable to go to the Doctoral Research Fellowship panel. Once we've developed that, we complete our application, submit that, and then if we're called for interview, we need to prepare for our interview. And I want to focus on various aspects of those key steps to success in the next few slides. So identifying the right scheme. So we're talking about a couple of schemes today in the whole programme, but there are, as Richard said, there are a whole range of NIHR programmes. There's the Doctoral Research Fellowship I'm going to talk about. There's the ICA programme, also discussed today. There are other NIHR programmes. There are also research councils offering fellowships, national charities such as Cancer Research UK. Also, there's local funding. Often that your local trust might have funding for PhD fellowships. Also, higher education institutions do. And I guess the key question here, if we decide to go for a doctoral research fellowship, is why a doctoral research fellowship as opposed to all these other types of funding scheme? The second big question about the right scheme is why a fellowship? So thinking about fellowships to do the work for your PhD rather than a project grant. And it is an important thing to have in your mind. Why am I doing a fellowship? Why do I want to do a fellowship rather than a project. So to understand the difference between a fellowship and a project is essential to prepare you for that. So applying to the right NIHR scheme in the right way. So first of all, make sure that you understand the scheme. So go to the website, look at the website, get as much information as you can, carefully read the guidance. You'll have queries most probably when you've read the guidance, so contact the NIHR Academy with queries. They're very approachable and very knowledgeable. They're a great resource. So once you've decided you might go for a particular scheme, look up previous award holders. Also look up the panel members, as Natalie said. So just be aware, first of all, previous award holders, what sort of person wins this award? And that, I mean by that, what level have they reached in their career? What sort of area are they working in order to win their award? Looking up panel members, and it's really just to understand the nature of the panel. A panel for a doctoral research fellowship interview is broad, it's multidisciplinary, and that helps you to guide you when writing your application, preparing a presentation, that you're speaking to the whole panel rather than just a couple with a particular narrow area of expertise that matches yours. So that's very important, understanding your audience. Also look up successful topics, gives you an idea of the kinds of things that the panel's members are looking for. So once we've done that, we need to identify our research focus. And, we have to link where we are, who we are, to the research focus. So ideally, build on your experience, or at the very least, make clear connections to your experience to justify why you're proposing to work in this area. Developing your project, we want something that shows that you're ambitious, that you're going to really have an impact in your research, because you're competing with everybody else. We want to get maximum impact for our money. So be ambitious in what you're planning to do, but also be realistic. It's got to be manageable for somebody doing a PhD in the time you have to do your PhD. And in doing that, really carefully choose your area. So it's something that has long-term scope, because we're looking here for people who are going to hopefully be future research leaders. If it's something that is a very narrow cul-de-sac, then that's going to be less attractive than an area that has much broader future scope to ideally expand into a much broader research area with time. Then choosing the higher education institute to work with, choose the right one. For your particular area of research, it has to have an established track record. We want you to work with a higher education institute that can really support you and contribute to your proposal. And then, as everybody said, take advice at every stage that you can. Seek input from those who might be able to help you make your research proposal and research focus stronger. Okay, so you've got what your research area is, then you've got to choose your supervisors. So some of these, I guess are obvious to some extent, but they're important to iterate. Choose good supervisors, and by that I mean people who've got proven record of success and who are well connected. So if you want, if your study involves getting access to a particular resource, whether it's a data set or equipment, anything like that, you choose somebody who can help you achieve that. Look at the track record of your proposed supervisors in the research area, because the panel will. Can this supervisor supervise research in this area? Then other aspects about the supervision question, sort of use this process to try and develop your own network of contacts. So thinking about what your supervisory team might look like, that's an opportunity to bring people in who would bring useful skills to your research. And do that nationally, but potentially do that internationally. If there is a good centre, say in the US, working in your area, think about a visit to them or them having some collaborative role in your project. So really make the most of your supervisors and collaborations. And a key thing always to bear in mind, of course, in terms of supervision, you're building a team here to do a project. The human aspect is incredibly important. Make sure that they're people you can get on with, because you're going to be stuck with them for 3 years full-time equivalent. So make sure that they're people you feel you can work with and who you feel are likely to be able to work with each other during the time of your project. You want to be in a position that they're advising you rather than you're having to supervise or manage your supervisors. Okay, so that's your supervision. So developing your project. Again, get advice from those who've done it before. Ideally, find somebody who's won the same award from your institution, if not an institution nearby or a similar award. Ask them to share their application and to give you advice on what their experience was. If appropriate, you might even ask them to be a supervisor. Then developing your proposal in terms of the research question. This is incredibly important. No matter how good your training is, your background, if you don't have a good research proposal, you're not going to be successful. So the first stage to getting a good research proposal is getting the right research question or research hypothesis. So it's important to spend time to think about that and get that right. And in terms of what we're interested in for the Doctoral Research Fellowship Programme, make sure your questions address something that's clinically relevant. It's got to be relevant to an NIHR's remit. Also make sure they're timely. What I mean by that is make sure that you can, when you're describing your research proposal, you can explain why it has to be done now. Why is it important that we invest in this research topic at the moment? And once you've achieved that, you've got a good, robust research question, then all the other things that go into your application, the literature review, the methodology, the theory, the background, the design of the research should quickly fall into place. And the last bullet point is an extremely important one. The big, most clear statement, if you like, about the requirements of research in these NIHR programs is it has to have clear impact on the NHS in 5 years. And when you write your application, really make sure you bring that out so it's clear to the panel. This is going to have impact in 5 years, and state what that impact is. So on to the writing. Well, when you're writing your project, make sure it's the right scale for a PhD project. So again, bringing in those with more experience than you who can advise you on what that right scale is. You have 3 years and limited resources. So a randomized clinical trial with many, many patients is not going to be doable in 3 years. Then we say ask for the appropriate level of support. So this is in terms of financial and other support. What's appropriate to enable you to do a PhD? If the project is many hundreds of thousands, £1 million, it's going to be much more difficult to justify against a less expensive project. Also, it's a PhD level project, and so the risk associated with that larger expenditure would be large, and you would really have to convince the panel that it's a good and viable risk. Then as you're writing, get your first draft together and get feedback as soon as you can. Don't go too far before starting to show it to others to make sure that you're on the right track and that you've got something that's good. And it's the nature of all research and planning research. Ideas develop, so your writing will go through several iterations, and you might find that what you finally end up with is actually quite different from what you started with. That's all good practice and a good part of developing research proposals. So really the take-home message here is get the scale and ambition right and start early and go through an iterative process. Get your supporters and experts involved in helping you to iterate your application so that you're writing something that's good. Then public and patient involvement. We just had an excellent talk about this, and it's important to get this right. It has to run through the whole of your application. If not, the panel will smell this out. And the panel is about 15 people from a range of disciplines. 2 of those panel members will be from PPI, and they will specifically ask you questions about PPI if you're called to interview. And I've seen statements about PPI. This is something I've seen in a grant application, not specifically in a fellowship application, but the statement was that the subject of this application is that it's a systematic review of COPD, therefore PPI is not relevant. That's completely wrong. You know, or anything that's relevant to an NIHR, it involves PPI, and it has to. There's plenty of help available for PPI, as we've just seen, so web-based resources, courses on how to run PPI, research design service are excellent at this. Your own hospital or your own local organisation will have hopefully a PPI coordinator or PPI group you can work with. And it's always an important thing with these applications, start early and get goodwill. And there are many advantages of PPI. Gary and Katie alluded to quite a few of them earlier. One of the aspects I've seen, it was actually at one of the panel interviews, we had somebody doing a project on a fairly complex mental health issue. And they were really struggling with the PPI. And at the interview, the PPI member helped them to work out how they could actually do this effectively and successfully. And if only they'd gone to these guys much earlier, it would have been much better for them. Also, in terms of developing your proposal, the research design service is indispensable. So I'm talking to you because I've got 6 years experience of sitting on these panels. In addition to the panel, we have a set of observers who come to panel meetings, and very often we have a couple of people from different research design services around the country coming to this. So the RDS will have experience of these panel interviews and of documents. They will have also seen a lot of applications. So they're a great resource for discussion of projects or any aspects of fellowships relevant to the NHS and to patient care aspects. They're very experienced, as I've just said, and again, as with all these other things, your supervisors, experts in the field, PPI, talk to them at an early stage. So when you're starting your application, think about who I need to get involved and start talking to them early on. So now let's think about what goes into your proposal, and if you like, aspects that go into your proposal that also need a lot of planning and bringing in other groups. So we've talked about healthcare professional groups, but a key part of your application is the finances. The finances have to be sensible. You have to ask for enough money to do the project, but obviously you can't ask for multi-million-pound funding for a doctoral research fellowship. So you've got to get that right. Get the finances sensible, so the right scale and well explained and well argued. Also, what often happens in the applications, people don't always consider their training needs properly. So make sure you've got enough money in there to do your training. And you need to understand aspects of finance that you need to talk to your finance officers too. So understanding NHS treatment and support costs, and in terms of higher education institutes, understanding direct cost, indirect cost, estate cost and all that. So you've got those numbers lined up and ready to go in. So again, completing your application, make sure you've got the right scheme, go through the guidelines with a fine-tooth comb, make sure you've got sign up from everybody in place ready to do this. Get as much information about what has been successful as you can. So use a successful proposal as a guideline, as a rough guideline. Get feedback in the process, work closely with supervisors to get things right. And last bullet point, use a spell checker. There's nothing that gives a bad impression to the panel than an application with lots of spelling mistakes. It looks, one could interpret that as well. They've not really focused on their application as much as they might. Make sure things like spelling are right. So completing the application allows sufficient time. You need to give your supervisors time to read your application and to see revised versions. Make sure you've got time to get the costings sorted out and your statements of support. You'll need a statement of support from your trust, from your higher education institute. Make sure they've got time to get these things right. So that's the process in terms of writing your application. So once the Academy reaches your application, receives your application, it's sent to 3 panel members for review. They're completely independent of each other. They review based on 3 areas: the applicant, the project, and the training program. And involved in that training program is also their higher educational institute. So you have those 3 areas. And we mark you independently, and then scores are compared. If we all say you should be called for interview, you'll be called for interview and asked to upgrade your application with the extra information. If unfortunately you're not successful, you will be given feedback. If the panel disagree with each other, then we have an extra meeting to decide. We don't, obviously, if it's unlikely you're going to get funding, we don't want to waste your time calling you for interview. But I think in practice, if we were uncertain, we would call you for interview. Well, we would call you for interview and give you the opportunity to convince us. So what we look for, we want a sound project. It's got to be clinically focused. And we want something that makes a difference. So we want something that's going to change practice and healthcare outcomes. We want a good, robust research question, and we want to see that you understand the relevant literature and good understanding of the theory underpinning your research. There was also this discussion of the question of let me just sort this out. With also this discussion of what we're looking for in terms of trajectory. We want people who are ambitious. If you've got 2 applicants, one who's got a clear plan for their career and one who's sort of uncertain, and everything else were equal, I think it's logical that you would take a risk on the person who's clear about their career. And there's no perfect answer to what are your career goals. It's, I think, having a plan of where you want to go to and a method to get there. We look at the higher educational institute, and we look at the supervisors and the supervisory team. Have they got the right skills that you need? And have you got the right sort of depth as well? So we don't necessarily need you to have 4 fellows of the Royal Society as your supervisors. I think we would be concerned if you did. What we want probably is at least one person who's very experienced with a lot of supervisory skills, but then you might have people who are less experienced, but they bring in other complementary skills. That makes a good supervisory team. So preparing for your interview, revise, read the background literature. Make sure that you also read your own application. Be prepared for what the panel are going to ask you on your application. Read up on your data analysis methods, that sort of thing. So revise. Then the next thing is practice. Have a mock interview. Usually they're much harder than the real thing. And make sure that you have as good a panel or as representative a panel for your mock interview as you can. So don't just have people from one discipline, have a range of disciplines with different backgrounds. Get some good questions. Get patient representatives involved. Get the RDS involved. And really practice in a realistic setting. So make it an interview, you know, act it out as though it is a real interview and learn from it.
Phil, just to warn you, Phil, you've got just about 4 minutes left.
Oh, sorry, I've just broken the rule. I'm going to talk, I apologise. So I'll stop at this because you'll have the slides anyway, but this is quite a key thing. For the presentation, don't have too many slides. You have 5 minutes. Don't go over time, the rule I've just broken. Make sure the presentation is vibrant, you know, show that you're interested and engaged with this, and avoid jargon. It's a multidisciplinary panel, so make sure that they can understand every aspect of what you're talking about. Okay, so this is just here what we look for in the panel. So perhaps I'll stop in case people have any questions.
Thanks, Phil. That was fantastic. That's a really comprehensive collection of some do's and don'ts in there. I've got one question here at the moment, but everybody else, please do write in the chat, or if you're feeling brave, unmute yourself and you can just ask Phil directly. But there's one question here. So it just says, in the training section, should we only focus on methodological and subject-specific training or other aspects of the research and development framework?
Yeah.
For example, ethics, dissemination, governance.
Yeah, the latter. You're applying for a fellowship whose purpose is to develop you into a future leader. So yes, there might be things that are specific to your project, that's project training, but also it's a great opportunity to get training to develop your broader skills. So I think we'd hope to see something relating to leadership skills. You might do something to do with clinical trials, you know, so that in future, you've got the training to develop clinical trials, you know, you might want to develop in that way. So a good breadth of training is essential.
Thank you. I had an add-on question to that. So what's the most creative or impressive request for training that you've seen proposed that the panel was supportive of?
That's a very good question. We've had some training where people have wanted to go to a place overseas, yeah, for a few days, you know, so to do a course and then to go to a collaborating centre. So that's a good example. I'll have to think about some others, but that's certainly one that stood out in my mind.
Yeah, we certainly get asked if you can travel abroad. So yeah, that's good to hear you say that.
It's got to be sensibly affordable, you know.
Yes, and not look like a holiday.
That well as well.
Yeah. Has anyone else got another quick question? We've just got a minute. No, everyone's very quiet.
Can I just ask the group then? I mean, is this is what I've presented to you the sort of material you want to know?
Yes, yeah. You've covered loads of things that we as advisors get asked on.
Okay, because that's the key thing. The last thing I want is present something and say, I hope he didn't. I was hoping he was going to present something else. Because please tell me if that's the case. I won't be offended. It's important that you get what you want out of these events.
Yeah, thank you. There's one other question which you might not have enough time to answer now. Actually, I know you won't. So it's about the breakdown of questions.
Yeah, I can. Yeah. So the way that after you've done your presentation, one person leads for 10 minutes on the proposal itself. So, sorry, on the research proposal. So you'll be asked about your research. You might be asked about sample size, why you're doing method A rather than method B. That's 10 minutes. And then you have 5 minutes from somebody else on the panel on your training. So they'll ask you to explain your supervision, why you're doing these, this course, another course. So that's 5 minutes, and then you have 5 minutes general questions.
Well done. I think you squeezed that all in there. Right. will be sent back to the main session now, or you can just press the little blue button.
Yeah.
Thank